Before you enter someone's face, wash your hands up just in case. Hey Mickey, hey Mickey. Before you Hey Mickey.
There's something going round and you're the missing link. You're going room to room, but you pass right by the sink. The germs live on your...
I'm going to be showing you how to wash hands using the alcohol rub. In the case of soiled hands, you would use the exact same steps except using water. You would wash your hands before touching a patient, after touching a patient, touching the patient's surroundings, when working with body fluids of the patient, and before doing a procedure. Apply enough soap to cover all hand surfaces. Rub hands palm to palm. Right palm over left dorsum with interlaced fingers and vice versa. Palm to palm with fingers interlaced. Back of fingers to opposing palms with fingers interlocked. Rotational rubbing of left thumb clasped in right palm and vice versa. Rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa.
My name is Lisa Marie van Varen. I'm a first year medical student and I'd like to have your consent to assess you today. Do I have it? Okay, perfect. We start off the general examination by feeling his hand for his temperature, and to me it is pretty fine. Then we will look at any coloration or discoloration of the hand or pigmentation. We check this to clear areas for jaundice, erythema or cyanosis, and there's no discoloration of his hand, so he's fine. Then we check for elasticity and turgor of his hand by picking up the skin of his dorsum, and as we can see, the elasticity restores pretty quickly, so there's nothing wrong with him. Then we will move on to I'll palpate his hand to feel for sweatiness or dryness, and his skin is fine. There's no signs of sweatiness or dryness, and that completes the skin examination. To the nail assessment, the first thing we check for is clubbing. We do this by assessing the nail bed. It's called rocking the nail bed. And to confirm that he does not have any clubbing, we will check all 10 digits for the correct angle between the nail bed and the finger. The second method of testing for clubbing is by performing the Shamroth test. This is where I ask the patient to put his 2 fingers together, like this, and we then check for an angle between the 2 nail beds, which is correct, which confirms that he does not have clubbing. Once we've checked for clubbing, we move on to checking for peripheral cyanosis. There's no blue discoloration of his nails, meaning that he has no cyanosis. The assessment for at his palms. The first thing we check for here is anemia. We just tilt the patient's hand backward like that, and when his creases remain red, it clarifies that he does not have anemia. Once we've checked for anemia, we move on to assessing his palms for any red discoloration. This signifies pulmonary erythema, which he does not have, as his palms appear a normal color. And then lastly, we check for the thickening of the palmar fascia. He does not have this, so he does not suffer from Dupuytren's contracture. Once we've done that, I'm just going to ask to lift up your sleeve. We assess the inner arm for any jaundice, which he does not have, so he appears normal to me.
I'm Marjorie van Skalkwyk, a first-year student doctor. I have washed my hands. Do I have your consent to examine you?
Yes, you do.
Please look up for me. This might be slightly uncomfortable. By asking the patient to look up, I exposed his sclera and bulbar conjunctiva. Upon examination, there were no signs of anemia, which would have presented as a pale conjunctiva. There was also no signs of jaundice, which would have presented as the yellow discoloration of the sclera. Jaundice could have been confirmed by checking his buccal mucosa, and also in a darker skinned patient, you could also check the inner forearm. There was also no signs of xanthelasma, which would have been cholesterol deposits on the eyes. Next, I will be examining your mouth. Will you please open your mouth and stick out your tongue? Please lift up your tongue. I just examined the tip, sides and the underside of his tongue. There were no blue discolorations, which means there were no signs of cyanosis. Next I'll be examining you for edema. Will you please lie down for me? I'll be checking for pitting by applying moderate pressure to your distal tibia. In the case of edema, when the skin indents, it would refill very slowly. Edema can also be checked by looking at the hands, feet, ankles and sacrum.
My name is Mohammed Vada. I'm a first year medical student and today I will be examining you. I've already washed my hands. Do I have your consent to examine your lymph nodes? Thanks. Please can you take off your jacket and remove your shirt? Okay, so we'll start with your pre-auricular lymph nodes. Then your post-auricular. Then your occipital. Then your tonsillar. Your submandible. And your submental. Now I'll examine your superficial cervical, your posterior cervical, and your deep cervical. And lastly, your supraclavicular lymph node. So basically what I was looking for is any tenderness, inconsistencies, abnormal size or shape, but you're fine. I didn't find anything wrong.
Thank you, doctor. We will now be doing a focused general examination on the abdomen. The patient will, as you can see, the patient will be exposed from the waist up, and there must be good lighting in the room. It is also important for the patient to lie 180 degrees on the bed and for his head to be on a pillow. It is also important for the bladder to be emptied and for the patient to be comfortable and relaxed before the examination.
Hello Hampton, I'm Marie Visser. I'm a first year medical student and this is Anke.
Hello Hampton, I'm Anke van Zyl and I'm also a first year medical student, and yeah, today we're going to do your inspection.
And you don't have to worry, we washed our hands.
Yeah.
First stage of inspection, we're going to look at the skin. Is there any abnormality in the skin like discoloration, abnormal hair distribution, rashes, scars or lesions, or ecchymosis, and that refers to bruising. Then we're going to look at the shape of the abdomen, and as we can see, the abdomen is flat in this patient. And then we're going to look at the symmetry of the abdomen. Is both sides of the abdomen the same? Yeah, it appears so. And then we're going to look for any enlarged organs, swellings or masses. Okay, and as we can see none of that. Okay, in terms of swellings, we can refer to hernias maybe, and that's when the patient coughs, then there will be a protrusion of out of the abdomen, and that can be, for example, in the umbilicus area, or in the femoral area, or the inguinal area. Okay, so we're going to ask, can you cough for us, Hampton? Okay, as we saw, there's no protrusions that we saw. Okay, then we're going to look at the pulsations in the peristalsis. The pulsations refer to the epigastric aortic area, and this may indicate any abdominal aortic aneurysms. And then we're going to look at the peristalsis movements, and this refers to the normal intestinal bowel movements. And yeah, as we can see, it's not clearly visible in this patient, but that's okay. You can normally just see it in thin people.
I'm going to inspect you for the standard abdomen. Now they call it the 7 Fs. Firstly you're going to look for fluid, and then feces, fat, tumor, phantom pregnancy and flatus. Now flatus and phantom pregnancy is not words you commonly use. Flatus is usually due to a bowel gas, and phantom pregnancy is usually when a woman so badly desires to be pregnant that she actually has the symptoms and hormones of a pregnant woman, and that causes the distended abdomen. Then there's also 3 clues to look for the distended abdomen. Firstly, usually when a patient is lying down, you can see that the flanks appear to be full. That is usually due to an excess fluid in the peritoneal cavity, and that's called ascites. Then a second thing you can look for is usually when the patient is very obese or fat, then the umbilicus is usually like hidden between the fat. And then the first and last clue that you can look for, when is pregnant, the umbilicus is like protruding outwards. So yeah, but Hampton, you are fine, you have no distending abdomen.
We're just going to be auscultating. I'm going to listen to for any abnormal bowel sounds. Usually bowel sounds occur every 5 to 10 seconds, so I'll be listening to each quadrant for that duration of time. The right lower quadrant. And move to the right upper quadrant. Then to the left upper quadrant. And finally to the left lower quadrant. I haven't heard any abnormal sounds, so everything seems to be fine. Examining the patient for bruise. Right aortic. And then to the left aortic. The right renal. The left renal. The right iliac. And the left iliac. Patient has no bruise.
Hi Hampton, I'm Janine van Zyl, a student doctor. I've washed my hands, and is it okay if I indicate the 4 quadrants and McBurney's point on your abdomen?
Yes, ma'am.
Will you please lie down for me? The abdomen is divided into 4 quadrants by 2 imaginary lines, a horizontal and vertical line. The vertical line runs through the midline of the body, dividing it into a right and left half, and the horizontal line runs through the umbilicus. This divides the abdomen into 4 quadrants. The right upper quadrant, which is above the liver, the left upper quadrant, which is above the stomach and the spleen, the left lower quadrant, which is above the colon, as all 4 quadrants, and the right lower quadrant, which is also above the colon, and McBurney's point is located in this quadrant. McBurney's point is a surgical point indicating the site of the appendix. It is found by drawing an imaginary line from the anterior superior iliac spine on the right side of the abdomen to the umbilicus. This line is then divided into thirds, and McBurney's point is located at the junction of the lateral third and the 2 middle thirds. Deep tenderness at McBurney's point indicates acute appendicitis, and during appendectomies, the surgical incision is usually made on McBurney's point.
Hi Hampton, I'm Elke van der Venter and I'm your student doctor for today. I'm just going to explain the 9 regions of the abdomen to you. I won't be touching you, but I have washed my hands in case you fear any infections or such. So there are 9 regions of the abdomen, and they're split up by different lines. There are 2 vertical lines called the midclavicular lines and 2 horizontal lines, the one being the transpyloric and the one being the transtubercular. Midclavicular lines are created by finding the middle of the clavicle and extending the lines downwards, both on the right and on the left. And the 2 horizontal planes, firstly there's the transpyloric plane, which can be found by extending a line horizontally at the bottom region of the rib cage, and the transtubercular line can be found if it's extended between the anterior superior iliac spine on both sides and made horizontally. These 4 lines then divide the abdomen into 9 regions, which are as follows. We have the right hypochondrium, which has the liver in it. On the left hand side we have the left hypochondrium, which contains the spleen, and in the middle we have the epigastric area, which has the stomach. Moving down we have the right lumbar region, which has the ascending colon and the right kidney. On the left we have the left lumbar region, which has the left kidney and the descending colon, and in the middle we have the umbilical area, which has the transverse colon and some small intestine. Lastly, at the bottom we have the right inguinal area, which holds your appendix, the left inguinal area, which has your sigmoid colon, and at the bottom your hypogastric area, which has small intestine, bladder, and a uterus in females.
Hello Hampton, I'm Laik van der Skeef. I'm your student doctor and I've washed my hands. Do I have your consent to examine your abdomen?
Yes, ma'am.
Okay, I make sure that my patient is comfortable and relaxed. Palpation must start away from any painful areas as indicated by my patient. And I'll also make sure, I'll observe his facial expressions and I'll reassure him during the examination. I am warming my hands beforehand so that it is more comfortable for my patient. And before I start my examination, I will look out for any rebound tenderness or guarding as I palpate. Okay, so I start at Macbrony's point in the right iliac fossa. I palpate up to the ascending colon, hepatic flexure, transverse colon, splenic flexure, descending colon, sigmoid colon, suprapubic region, preumbilical region, and the epigastric region. I also, while examining, I look for any changes in temperature, muscle rigidity, or light masses, or any pulsations. And from what I felt and palpated, everything seems normal.
Hampton, my name's Abigail van der Beestes and I'm a student doctor. I'll be assessing you today and I'll be palpating your abdomen and stuff like that. I have washed my hands, so are you comfortable with me doing that?
Yes, ma'am.
Great. While we palpate your abdomen will be to assess for enlargement of organs, tenderness, or even irregularity of surfaces and things like that. So firstly we'll be palpating the liver, and we do so in a vertical manner because the liver enlarges inferiorly. So to do that, I'm just going to ask if you lift your thank you, you can lower it like that. Okay. So the landmarks that we use are the costal margin, which are marked by the edge of the ribs, as well as the rectus abdominis, which is found here. So if you could just look forward from here. There we go. Those are the rectus abdominis that are activated right there. So starting off, we start in the lower right iliac fossa, and we use the edge of the rectus abdominis, which was just identified as our marker. So we're starting in the right iliac fossa. We will be palpating vertically upwards towards the costal margin. And Hampton, if you could just breathe in and out through your mouth, please. And out. Okay, in again. And out. In. Out. In. Out. In. Out. One more time. Out. Okay, thank you. I don't feel anything there. I'm confident that your liver isn't enlarged, but if I were to feel the edge, it would usually feel like non-tender, smooth, sharp, but firm. And that would be the normal state of the liver. Next, I'm going to be palpating your spleen, and this is going to be done slightly differently. It will be done transversely across your abdomen. The reason we do this is because when the spleen enlarges, it enlarges inferiorly and medially across that. I'll be placing my left hand underneath your costal margin. Thank you, low. Okay. And then just as with the same method as with the liver, I'll be palpating transversely across your abdomen. So once again, I'm going to ask you to breathe in and out through your mouth. Out. Okay. In. Out. 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 One more. Out. Okay, great. I'm very confident in, that your spleen hasn't enlarged, but it is always an option for the doctor, if he's not certain, to ask the patient to roll over on their right hand side and to repeat the palpation just to confirm that there's no enlargement. But otherwise, we're very confident that your spleen and your liver are in good functioning.
Thank you, ma'am.
Hampton, my name is Sinead from the Westhuizen, and I'm your student medical doctor for today.
I did wash my hands. Is it okay if I percuss you?
Yes, ma'am.
3 reasons why we're going to percuss you is to determine any masses or organs in your body and to determine if they are enlarged or not, any fluid that might be in the peritoneal cavity, and to elicit any tenderness in the case of if you have peritonitis. Resonant, 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 resonant. On the abdomen, all the percussions was resonant. It means there's no abnormal masses there. I'm now going to go over to percussing the liver and determining the liver span. Okay, so to determine our landmarks, we use the sternal notch, the angle of Louis to the second rib, to the second intercostal space. Resonant. Third. Resonant. Fourth. Resonant. Fifth. Resonant. Sixth. Dull. Dull. So this is in line with the midclavicular line, about 2 fingers beneath the lip nipple. I'm now going to start percussing as well from the right iliac fossa region, still in line with the midclavicular line. Resonant, 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 dull, resonant, dull. So this is the span of your liver. We just determined your liver span and it seems to be about 10 centimeters. I'm happy because that means it is below 13 centimeters. It's in the normal range.
I can't do this all on my own. No, I know I'm no Superman. I'm no Superman.